it is not dying down. There's no vaccine. This variant is different than the ones you have dealt with in the past.
That's right. This is the Bundi Bunjo, which is a different strain. So the typical strains are the Zaire, the Sudan strains. So for historical context, the majority of outbreaks have taken place either in Sudan, Uganda, Democratic Republic of Congo, all Central Africa. And so Democratic Republic of Congo used to be called Zaire, so that's why it's called the Zaire strain. So Zaire and Sudan strain represent about 90 to 95%. This is a different type of strain. So we didn't have the tests, we didn't have the therapeutics, we didn't have the vaccines for this strain. Now that we are, we currently have advanced vaccines that are currently in trial for animal studies, but this stuff takes time, and probably there's 3 different ones right now. It'll probably take several months, hopefully by the end of the year. But we don't have the time, and that's really the sort of concern here. We lost a lot of time because we didn't have the tests either. So the tests that we're usually using, these point of care tests, are typically, again, set up for those other strains. So we didn't know that it was happening. And so we lost a lot of opportunities to sort of contain that. Then we're also dealing with conflict, right? This is one of the most conflicted nations in the world. As the result of the Rwandan genocide of 1994, and even prior to that, there have been a number of rebel groups that have entered Congo. And so this is a serious concern. It's very hard to get in there. It's very hard for trusted messengers to get in there. There's not a lot of trust in there as well. In terms of folks, loved ones that pass away, their bodies are being taken away from them. There's reasons for that because of the first 48 hours after death, those are actually the highest risk of transmission. And so, a number of people just feel as if, the government is against them and this is all a plot. So it's really hard with all of those conditions. I write a lot about this in my book, Pandemics, Poverty, and Politics. With all of those conditions, this really creates a recipe for disaster. And the last piece I forgot to mention was, we have pulled back globally. We have pulled back investment from infrastructure in Congo and in Uganda because of the pullout of USAID, because of the pullout of the CDC's global health response, because of our pullout from the World Health Organization. This has really impacted Congo's ability to respond.
Less than a minute left. We have a question in the chat asking about that first case of Ebola in France. How someone may have brought it back, and obviously what that concern is there. About 30 seconds, please.
It was a humanitarian healthcare worker, a hero. Basically, this has happened in the past, happened in the United States as well. When somebody comes back, these things can happen. Looks like that is being contained. So, we're definitely tracking that. And anybody that was in close contact is going through contact tracing.
All right. Well, Dr. Tyler Evans, give us the name of that book that you wrote one more time if folks want to get a hold of that.
Sure. Pandemics, Poverty, and Politics, published by Johns Hopkins University Press. You can find it on Amazon, Barnes & Noble.
All right. We appreciate your insight into this. And of course, this is not over, as you mentioned, so we'll probably keep you on the horn and get updates from you. We appreciate your time.
But still have a good summer right now. Just stay tuned. I don't want to be alarmist. United States, there are no cases.
All right.
Thank you.
Thank you, Doctor. We appreciate it. Have a good one.